Hello again. I'm Jan Rayl, and welcome back to Going Strong. It's my privilege and honor today to introduce you to a guest that we corralled from his very busy practice to get him over here this afternoon. That is Dr. Kurt Wharton, who has an incredible women's health practice in Lafayette, California. Kurt, welcome.
Thank you, Jan. Thanks for asking me.
I'm so glad we finally got you here. I only started this, 6 months ago?
Just the other day. But it's a pleasure to be here. Thank you. I've been looking forward to this.
I'm glad to have you, and especially to have a nice local boy, grown and raised in Oakland.
Yeah, actually, I was born in Oakland. I grew up in Oakland, in Piedmont. Went to college at Cal.
Yes.
Yeah, go Bears. And after that, I went to Massachusetts. I went to Boston. I was advised to go to the medical mecca of the world. And it was an interesting 4 years of alternating cold and heat, but I was very happy to come back and do my residency in San Francisco. I was chief resident UC San Francisco, and I was fortunate enough to be able to come back to the East Bay, my home.
And you and your wife are right here in the East Bay, and your family, and everybody's right here.
Right here.
Kurt, you have a tremendous practice. I have not been your patient yet, but after what I heard, I think I should be. I was very interested in a couple of things that you told me that you were involved in. One is incontinence, which is a tremendous interest to all of us over a certain age, I think. And another was the late first-time pregnancies for those of us who are older who are having our first babies. But incontinence really kind of caught my eye, especially your pamphlet, your little pamphlet you have on laugh, cough, jog, sneeze, leak. Tell a little bit about what's happening in incontinence as far as what we can expect as we get older.
Well, the most important thing that's happening in incontinence is that we're talking about it. We're able to talk about it today in this public forum, where very recently, and in many parts of the country, people aren't comfortable talking about this, but this is a huge problem. Each year, our population gets a little bit older. That's just a fact. Our population, as we mature, women live longer than men. And for women who've had children, even some women who haven't had children, incontinence becomes a small problem that grows with each passing year. We no longer are willing to accept that as just a passing fact of the aging process. There are so many things we can do now to correct that, and I believe make a great improvement in people's quality of life.
What are some of the options that are available to us? I just love that laugh, cough, sneeze, jog, leak.
Yeah, it's a wonderful tool, and it really explains to people that this is not something you have to live with. That simple activities such as dancing and having a good laugh don't have to result in leaking. We have brochures that I'd be happy to mail to our listeners. I can give a phone number where they can contact me. For free? For free.
We can get a brochure from you?
I'll send 2 brochures.
To everyone who calls this. All right, what is the number, please?
The number is here in area code 925-962-0002. That's my office number. If the patients and public leave their name, address, and phone number, we'll be happy to send a pamphlet describing the symptoms of stress urinary incontinence, as well as other types of incontinence such as urge incontinence or just overactive bladder spasm.
Did you hear that, ladies? He's offering us all a free booklet. I suggest that you get it. I know that gentlemen have issues here too, but right now we've got our women's health specialist here with Dr. Kurt Wharton, so take advantage of that, and when his office calls me to personally kill me for everyone calling in, we can say Dr. Wharton did it. But do try to get that pamphlet. It's excellent. Thank you for doing that for all of us.
My pleasure.
Now, what beyond reading the pamphlet and maybe doing kegling?
Kegling is very important. It's something that we've been doing for some time. We know it helps, but we're all very busy. We have many distractions each day in our life, but we need to remember that this problem of incontinence didn't occur overnight. It often occurs because of pregnancy, childbirth. Often it's a result of lifestyle. People that do a lot of straining and lifting. Some people are plagued by constipation. People that smoke will sometimes develop a nasty cough that shocks the pelvic floor, and all these things can contribute to incontinence. So we spend a lot of time talking with people about their lifestyle. What can we do to change their lifestyle? Many people have experienced an increase in their body weight, and if we help people work on decreasing their body weight, that can greatly help. But then we start with reminding people. I have a handout that I give to people explaining them how the Kegel muscle exercise works and why it works. And if people are with me in the office, we'll actually go and take a few minutes and practice, because many times we'll give people instructions, but it's truly not clear what they're supposed to do.
I think you better review that with all of us. Now, Kegling is named for Dr. Kegel, is
That's
that right?
correct. He was a very smart man. He's truly way ahead of his time.
I thought it was a woman. Just kidding.
No, unfortunately, a few of us are still
enlightened.
Yes, there's a few of us. But with Kegel exercises, one tightens the pelvic floor muscles that surround the bladder and the urethra. These muscles have become weakened over the years, and by exercising them on a regular basis, we can see dramatic improvement. But it takes effort. It takes dedication. I encourage people to become zealous in their workout ethic. Many of us think, well, we're getting a little thick around the middle. I'm going to go to the gym. I'm going to spend some time working on that. But this muscle is just as important. By performing Kegel exercises for 10 or 15 minutes once or twice a day, unfortunately, it's necessary to do it more than just a few days at a time. Quite honestly, one has to do Kegel exercises for 2 to 3 months to see a significant improvement. But more often than not, those improvements are seen, and people are quite pleased. We do have some patients who, try as they might, can't do Kegel exercises. Patients that have had difficult experiences in childbirth commonly will have damage to the nerves. There are other people who've had traumatic injuries that have resulted in nerve damage. And these people, try as they might, they can't connect their brain to their pelvic muscles because of the injury to the nerves. So we have devices that we're able to use to train the muscles. We have a wonderful device that we're able to use remotely to improve muscle strength. I actually happen to have a version of it with me right here. This is called the Athena Pelvic Trainer. May I hold this up for the camera?
Yes, or I'll hold it for you. How's
Please
that?
do. Your hands are prettier than mine.
Thank you.
And I'm proud to say this device has been developed and marketed by a local company based right here in Orinda. And
Can I take this out?
Oh, please. Yeah, take it right out. This is a miracle device. We're able to benefit from the advances in modern technology and computer technology. This device, it's about the size of a lipstick or a tampon, contains a battery. I have patients come to the office and I demonstrate how to use this, and it's very simple for them to use at home in their own privacy and comfort. But that goes inside the vagina, and using a radio frequency transmitter built in this cradle, they're able to activate the button, which sends the radio signal to the device, right, like that. And for the next 15 minutes, the trainer will emit electrical stimulation, which results in spontaneous Kegel muscle contraction.
I know how to handle this because you have helped me, along with my other doctors, with my own stress incontinence after a head injury. So I've become pretty adept at this thing, and it made a tremendous difference to me, and I really thank you for all you've done for me personally and for everyone else who's been able to use this.
I'm very happy to be of help. But this is a great breakthrough device. I can also send the studio audience out there copies of a pamphlet that describes this in detail.
That's free
as well
too?
as a website. That's also free.
Thank you for bringing that.
Oh, you're welcome.
So that's one electrical stimulus that has been successful with quite a few of your patients, no doubt?
Oh, quite a few. And there's been other benefits as well, in addition to improving stress urinary incontinence. That incontinence which is due to coughing, sneezing, laughing, giggling. We're finding that women who have urge incontinence are also experiencing significant improvement. And there are some poor souls who are cursed with chronic pain of the vulva. It's has historically been an extremely difficult condition to treat. We've tried surgeries, medications. Most of them have not been very successful. And unfortunately, this condition usually continues and takes over people's lives. But there are many women who found benefit from this electrical stimulation. And
because it's working on the whole area.
Working on the whole area.
Everything. All right, now, for the people who those few that may not be helped, or the group that may not be helped by this, or may be helped pre-surgery, post-surgery, there's an incredible procedure that you have. Did you develop the procedure?
No, I can't take credit for that, but it's something I've been following for several years. It was actually created in France, and
should I get my prop up?
Yes, we happen to bring a replica of a human pelvis with us today.
Yes, I have my beautiful prop here.